Weird signs that you may have Lyme disease. Lyme disease is a tick-borne illness caused by the bacterium Borrelia burgdorferi, primarily transmitted through the bite of infected black-legged ticks, commonly known as deer ticks. It is one of the most common vector-borne diseases in the United States and Europe, particularly in regions with dense woodlands or grassy areas. The disease often begins with flu-like symptoms, including fever, headache, and fatigue, and may present with a distinctive bullseye rash at the site of the tick bite. If untreated, Lyme disease can lead to more severe complications, affecting the joints, heart, and nervous system. Early detection and treatment with antibiotics are crucial to prevent long-term health problems. Today, we will discuss the unusual or unexpected symptoms that can make Lyme disease diagnosis challenging. These weird symptoms can lead to misdiagnosis or delays in treatment, emphasizing the importance of recognizing the wide range of potential symptoms of Lyme disease. Let's take a closer look at our first sign, Bell's palsy. Bell's palsy, a sudden paralysis or weakness on one side of the face, is an unusual and striking sign of Lyme disease that can be alarming to those affected. This neurological symptom occurs when the bacteria affect the facial nerves. Bell's palsy can cause drooping of the eyelid and mouth, loss of facial expression, and difficulty closing the eye or smiling. What makes this symptom particularly unusual is that it can appear early in the disease, sometimes before more recognizable signs, leading to confusion or misdiagnosis. Unlike other causes of Bell's palsy, the involvement of Lyme disease makes it crucial for patients experiencing facial paralysis in areas where Lyme is prevalent to be tested and treated promptly. Weird sign number 2, brain fog and cognitive changes. Brain fog and cognitive changes are often overlooked signs of Lyme disease that can significantly impact a person's daily life. The bacteria can affect the brain, leading to mental confusion, memory lapses, and difficulty concentrating, collectively referred to as brain fog. Patients may struggle to recall simple information, find it hard to focus, or experience slowed thinking, which can feel similar to early dementia or other neurological conditions. These cognitive issues can arise unexpectedly, making it difficult for individuals to function normally at work or in social settings. Because brain fog is such an unusual symptom of a bacterial infection, it can easily lead to misdiagnoses, delaying proper treatment for Lyme disease. Moving on to our third unusual sign, unexplained mood changes. Unexplained mood changes are an often surprising sign of Lyme disease, highlighting how the infection can affect not only the body, but also the mind. The bacteria can invade the central nervous system, leading to emotional instability. Patients might experience sudden bouts of anxiety, depression, irritability, or even intense mood swings without any clear triggers. These emotional shifts can seem disproportionate to external circumstances, leaving individuals confused or worried about their mental health. This psychological impact of Lyme disease is often misattributed to stress or other conditions, making it a challenging symptom to connect with the infection. Now let's delve into our fourth unusual symptom, visual disturbances. Visual disturbances are a strange and less known sign of Lyme disease, adding to the complexity of its diagnosis. The bacterial infection can interfere with vision. Patients may experience blurred vision, increased sensitivity to light, photophobia, or the sensation of seeing floaters, small, shadowy shapes drifting across their field of vision. In more severe cases, Lyme disease can even cause temporary blindness or double vision. These visual symptoms can seem disconnected from more well-known Lyme indicators, making them easy to overlook or attribute to unrelated eye conditions. The occurrence of visual disturbances in Lyme disease reflects how widespread the bacteria's effects can be throughout the body, including the eyes, further complicating the diagnostic process. Let's talk about our fifth weird sign, tingling or numbness. Tingling and numbness are unusual signs of Lyme disease that highlight the infection's ability to affect the nervous system. Lyme disease can trigger neurological issues, leading to sensations like tingling, numbness, or even a burning feeling in the extremities, such as the hands, feet, or face. These sensations, known as neuropathy, can be intermittent or persistent and may occur without any obvious cause. For some, the numbness might feel like pins and needles, while others may experience complete loss of sensation in specific areas. Because these symptoms can mimic conditions like multiple sclerosis or carpal tunnel syndrome, they are easily misdiagnosed, especially when no other typical Lyme signs are present. Unusual sign number 6, heart problems. Heart problems, particularly Lyme carditis, are a rare but alarming sign of Lyme disease that many people might not associate with a tick-borne illness. Lyme disease can impact the heart when the bacteria infect cardiac tissue, This can lead to irregular heartbeats, arrhythmias, heart palpitations, chest pain, or even more severe complications like heart block, where the electrical signals that control the heart's rhythm are disrupted. These symptoms can emerge suddenly and may be mistaken for other cardiovascular issues, making the connection to Lyme disease difficult to identify. Lyme-related heart problems, though unusual, can be life-threatening if left untreated, stressing the importance of recognizing these symptoms in patients who may have been exposed to ticks. Moving on to our seventh weird sign, hearing issues. Hearing issues, such as tinnitus, ringing in the ears, or hearing loss, are unusual signs of Lyme disease that many people may not expect. The bacterial infection can affect the auditory system. Some patients report persistent ringing, buzzing, or a feeling of fullness in the ears, which can vary in intensity. In more severe cases, Lyme disease can even lead to partial or temporary hearing loss. These auditory symptoms are often mistaken for age-related hearing decline, ear infections, or exposure to loud noises, making it difficult to link them to Lyme disease. Let's talk about our eighth weird sign, migrating joint pain. Migrating joint pain is a strange and often confusing sign of Lyme disease that sets it apart from other joint-related conditions. Unlike typical arthritis, which usually affects specific joints consistently, Lyme disease can cause this migratory nature makes it difficult to pinpoint the cause and can lead to misdiagnoses such as rheumatoid arthritis or fibromyalgia. The pain may be accompanied by swelling and stiffness, but its moving pattern can make it harder for healthcare providers to connect it to Lyme disease. Moving on to our ninth unusual sign, sleep disturbances. Sleep disturbances are an unusual yet significant symptom of Lyme disease that can greatly affect a person's overall well-being. Lyme disease can disrupt sleep patterns, leading to insomnia or difficulty staying asleep. Patients may find themselves waking frequently during the night or experiencing restless sleep, often accompanied by vivid dreams or nightmares. These disturbances can leave individuals feeling exhausted during the day, exacerbating other Lyme symptoms like fatigue and cognitive difficulties. The connection between Lyme disease and sleep disturbances is not always recognized, as these issues can easily be mistaken for stress or anxiety. Moving on to our last weird sign, neck stiffness and meningitis-like symptoms. Neck stiffness and meningitis-like symptoms are unusual yet concerning signs of Lyme disease that can emerge when the infection affects the central nervous system. The bacterial infection can lead to neuroborreliosis, causing inflammation of the membranes surrounding the brain and spinal cord. Patients may experience severe neck stiffness accompanied by intense headaches, sensitivity to light, and nausea, which can mimic classic meningitis symptoms. This neurological impact can be alarming, especially since the stiffness and pain may not immediately connect to a tick-borne illness. The presence of these symptoms is a crucial indicator that Lyme disease has progressed and stresses the importance of early detection and treatment. The unusual signs of Lyme disease